let's talk about A flutter. A flutter is a consequence of something called a circuit reentry phenomena. A circuit reentry can happen between only a few cells, or it can involve a large number of cells. If it's only a few cells involved, we call that a microcircuit. If a large group of cells are involved, we call that a macrocircuit. In the case of A flutter, we're dealing with a circuit reentry in the right atrium. Now, let's talk about what a circuit reentry is. During a normal cardiac event, an impulse travels from what we call a point of an origin, and then it returns back to where it came from. However, because there's nothing slowing that impulse down, by the time it returns back to the point of origin, all of these cells over here are still in absolute refractory period, meaning they cannot be re-stimulated. Now, what happens during a circuit reentry is that there is a slowing of the conduction somewhere along the path of the impulse. Now, this could be as a result of ischemia or injury, scar tissue, maybe enlargement. But whatever the case may be, because the conduction gets slowed down, by the time it makes it back to the point of origin, the cells over here are either at the resting stage or in a relative refractory period, and they can be re-stimulated. So what happens is that you will get this circuit that will just go on and on and on and on and on. In the case of A flutter, this circuit re-entry will give you what is called a sawtooth pattern on your EKG. These so-called F waves are best seen in leads 2, 3, AVF, and of course V1. A flutter could be regular. For example, you could have 2 F waves for each QRS complex, in which case you would document you have an A flutter with 2-to-1 conduction. Or you could have an A flutter that's irregular with what we call variant conduction. Now, the easiest way to figure out your conduction to QRS ratio is to draw a line over your peak and count your troughs.